to thank Moira and Erin for giving me the opportunity to share with you today this presentation on the work that we're doing at a global level to advance integration of palliative care into humanitarian settings. So as Joan has mentioned, the scope of my presentation is to present a high-level overview on the efforts that the World Health Organization, in collaboration with partners, is leading to integrate non-communicable diseases and particularly palliative care into the global humanitarian response. So you can see here the main areas that I would walk through my presentation today. So the World Health Organization calls on member states to expand access to equitable palliative care. And 2024 marks the 10th year anniversary of the resolution on strengthening of palliative care as a component of comprehensive care throughout the life course. This was the first ever standalone resolution on palliative care to improve access of palliative care as a component of health systems. And these are outlined here are the main actions that were mandated through this resolution, which include improving access to essential medicines, creating stronger policies, enhancing training for healthcare workers, support caregivers, and promote collaborations and partnerships to improve the quality of services among the countries. So why is it important that we advocate for the inclusion of palliative care into the emergency response in humanitarian settings? We are all aware of the global need for palliative care continues to grow as a result of the aging of populations, the rising burden of non-communicable diseases, and currently due to the ongoing escalation of global crisis. So 10 years after the resolution, there is still insufficient access to palliative care, as only 14% of people in need for palliative care can access it. Humanitarian crisis, which includes natural disasters such as earthquakes, public health emergencies as infectious outbreaks, overwhelm and collapse health systems. Humanitarian crises have a catastrophic impact, particularly on people living with NCDs, because their pre-existing conditions are exacerbated substantially due to the disruption of the health services. Provision of palliative care, therefore, to address critical symptoms such as pain, trauma, and ensure dignity and compassionate care, particularly for those in dire conditions, is not only a medical responsibility, but it's also an ethical necessity in these settings. So I will share in the next slides with you what have been some of the key activities that the World Health Organization is leading together with partners, focusing on the three main functions of the organization. So focusing on the normative function of producing guidelines, focusing on the country support, and particularly now, very importantly, on the leadership function. So talking about the normative function, WHO has produced a series of guidance documents to support integration of palliative care and non-communicable diseases into the emergency response. You can see here, and you're probably aware of the series of WHO integration of palliative care, and particularly the one that was launched in 2018 provides guidance on the integration of palliative care and symptom relief, providing practical consideration for policymakers and program managers. It provides triage guidelines to manage patients based on their condition, prognosis, and available resources, as well as outlining essential packages of palliative care services. Another important document that it's recently in press is the operational manual on non-communicable diseases in humanitarian emergencies. This represents a tool to advocate for integrating non-communicable diseases and palliative care into the national health emergency response frameworks and humanitarian planning using all hazards approach. This tool provides recommendation to define and maintain essential service packages for non-communicable diseases, ensuring the continuity of care, including life-saving medications and specialized services such as dialysis and cancer care. This document provides recommendation as well to ensure financial preparedness and protection, to secure funding to support the essential non-communicable disease services, including the procurement of medication and medical supplies. So talking a little bit more about country support, I have been asked also to focus on the region of the Americas, but just wanted to provide some essential background on the work led on the emergency cluster by WHO. So WHO at the global and national levels ensures coordination among various health actors, including the governments, UN agencies, non-governmental organizations, and other humanitarian organizations. So WHO has been providing support to countries to achieve universal health coverage with the inclusion of palliative care, and more recently providing support to the delivery and implementation tool known as the SPIDI tool to the request of member states that want to include palliative care in the national benefit packages for humanitarian response. Particularly as I've been asked to share with you some of the progress and challenges in the region of the Americas. So thanks to the collaboration from my colleagues from the Pan American Health Organization, PAHO, we understand their efforts to provide support to the governments, particularly of Panama and Colombia, to address the crisis in the region of the Darien. The Darien region is a selvatic area in the border between Panama and Colombia, a vast jungle territory where migrants face severe conditions due to the lack of access to emergency care and the adverse environmental conditions. But through the multi-stakeholder collaboration, including governments, cooperation agencies, civil society, and academia, articulated preparedness, response, and recovery strategies are being put in place to design to address the health needs of the migrants in the area. Also, the Pan American Health Organization is leading training and education activities through a sub-regional palliative care ECHO program, which is targeting 8 countries in the English-speaking Caribbean. And more recently, they have implemented a Latin American Emerging Palliative Care Leaders program with the aim to support future generations of palliative care leaders in the region, building competencies, focusing on palliative care advocacy and strategic planning. And I have shared previously with Erin some of the links to this document so you can review in more detail. And finally, aligning with the World Health Organization leadership function, I will summarize here in this slide some of the main resolutions and policy mandates that underscore the importance of incorporating palliative care and non-communicable disease services into the emergency preparedness and humanitarian response strategies to ensure that comprehensive, inclusive care for all populations affected by the crisis is provided. An example of this is the World Health Organization NCD Action Global Plan from 2013 to 2030 that calls for member states to ensure continuity of non-communicable services, availability of life-saving technologies and essential medicines in humanitarian crisis. And now this is a particularly important moment as we are preparing to the 4th high-level meeting on NCDs, which provides a critical platform to advocate for the integration of palliative care, cancer, and NCDs into the global humanitarian response. And as part of these activities on the way to 2030 and to the 2025 high-level meeting, there was a very important meeting at the beginning of the year in February, organized by the Kingdom of Denmark. And Moira had the opportunity to participate directly in this event and contribute to a WHO side event on palliative care and emergency settings. So momentum is building around the high-level technical meeting on NCDs, and participants to this meeting emphasized the urgent need for inclusive, comprehensive care frameworks that address both chronic diseases and palliative care in a humanitarian crisis. As an output of this meeting, and you can see below here, our team in headquarters have submitted to the Lancet Oncology this manuscript that calls for specific actions to provide a standardized response with the inclusion of cancer care and palliative care in humanitarian crisis. And here to the left, you can see some of the specific actions that this global vision for action is recommending. So integrating palliative care into national preparedness and response plans to address specific needs of children with cancer, and strengthening workforce resilience, improving data collection and surveillance to inform decision-making process, foster multi-stakeholder collaboration, and particularly very important, advocating and financing for sustainable palliative care service provision. So just to finalize, I would like to leave with you some reflections. And I think that we are very conscious that the continued rise in conflicts and humanitarian crisis highlights the urgent need to protect the most vulnerable populations, including children and adults affected by cancer. Strengthening health systems to be resilient in the face of emergencies is crucial. This involves a focus on preparedness, ensuring that health providers are equipped with the necessary training and that the resources are mobilized effectively. Collaborative global action through multi-sectorial partnership between governments, international organizations, and humanitarian actors to develop adaptable care models are fundamental to ensure that no one in need for palliative care is left behind in total pain, even the most challenges of circumstances. So I thank you for your attention.